Tonight on MedTalk, as we welcome the brand new year, we look back at two of our most significant episodes this year. We continue joining hands to find solutions to your medical queries, courtesy of our guest doctors from different fields and expertise. This time, we look back at two episodes, post-traumatic stress and attention deficit hyperactivity disorder, or ADHD. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel. Twin disasters struck the Philippines nearly 1 month apart. The 7.2 magnitude earthquake that shook Bohol, Cebu, and other neighboring provinces, and the super typhoon Yolanda. More than damages to property, it left a lot of people seeking medical help and assistance as they rebuild their lives. We look back at our episode centering on a growing health concern, particularly those who might be undergoing post-traumatic stress. On November 8, 2013, one of the strongest storms ever recorded in history struck the Philippines. Typhoon Yolanda, with an international name Haiyan, swept through the middle of the country, leaving a massive trail of destruction in its wake. The damage and loss of life, unthinkable. According to the National Disaster Risk Reduction and Management Council, or NDRRMC, Typhoon Yolanda has claimed the lives of more than 2,000 people as of Tuesday morning. About 4 million people are believed to have been affected by Typhoon Yolanda, according to the initial estimates made by the Philippine government. These can lead to post-traumatic stress syndrome, a mental health condition triggered by a tragic event. And while anyone can go into shock right after experiencing tragedies, the shock can be interpreted as post-traumatic syndrome once the symptoms persist for more than a month. What happens to people immediately after a disaster or other traumatic events? How can one properly deal with post-traumatic stress? When should you seek professional help? All these and more tonight on MedTalk. In the aftermath of Super Typhoon Yolanda, many Filipinos are left homeless, fearful, and traumatized. Tonight on MedTalk, we will be having clinical psychologist and former president of the Psychological Association of the Philippines, Dr. Honey Carandang, who will share with us her expertise specifically on post-traumatic stress disorder. You may join the discussion by calling our hotline at 548-4678. Good evening, Dr. Honey. Welcome to the show.
Good evening.
Post-traumatic stress disorder. What exactly is this?
Okay, that's usually called PTSD. No? Medically, it's a diagnostic term, yung label na ginagamit natin when we are describing somebody who has undergone a trauma and has lasted for a certain period of time. Pero siguro, to make it more understandable for everybody, let's just talk about trauma. No? What is trauma?
What exactly? You mentioned it, Dr. Honey. Trauma. What is trauma? What are the characteristics of trauma?
Okay. Trauma has about at least 3 elements para malaman mo kung traumatized ang tao. You will see that a person who's traumatized will have what you call hyper alert body. No? Yung parang your whole system is on red alert. So hyper vigilant ka. Konting ingay lang talagang
you get jumpy.
You get startled easily. Yun yung isang mamanonotice mo. So doon sa disaster once when we were talking to the people na mudslide na sila, na wala na yung bahay na matayan, there was a big storm, malakas na malakas. But when we went there, it was just a shock, yung parang ambon lang. But the symptoms they had then were totally transferred to that time we were talking to them na meron na mahina lang yung ambon, pero yung pakiramdam nila bumalik dun sa dati nilang pakiramdam na talagang malakas na malakas ang ulan. So that's part of hypervigilance kasi yung system mo is always on guard. Hindi ka makarelax. Yun. That's
So
one.
aside from hypervigilance, what else?
So isa pang trauma, isa pang ano doon, parang characteristic, parang malalaman mo, parang palagi kang merong images, mga pictures na paulit-ulit umiikot-ikot sa mind mo, parang nag-i-intrude. It's called intrusions eh. No? Parang hindi mo iniisip, wala kang naglalakad ka lang, hindi mo iniisip, biglang mapapasok sa isip mo yung nakita mong frightening scene. Or it has its own life. The images come to you unbidden, parang they have their own life, parang hindi mo makontrol. So that's again, you feel parang wala kang control, no? Because they are just coming in, hindi mo mapigil. Or kung baga sa mga children or even some adults, you can have nightmares. That's part of the intrusions of the images. But on the other hand, meron ding mga tao na totally parang paralyzed, numb. Kita mo walang reaction, walang emotion, parang walang nangyari. Pero that's another kind of symptom, which is numbness, no? Parang shock. So, kausap mo siya, nagsasalita yung bibig niya, pero parang wala siyang emotion. So, doesn't mean na okay siya. It doesn't mean na hindi siya traumatized because that's another element of trauma, that you are rendered paralyzed and numb and you cannot feel anything. You're like a body walking but walang laman. No, if you've ever felt that way, na state of shock. Ginagawa mo yung mga dapat mong gawin, punta ka sa banyo, pero parang wala kang, parang robot ka lang. You have no feeling. So that's another element ng trauma.
Do these traumas last? Kunyari yung natutulala, does it last for a long period of time or does it come and go?
That's important kasi dapat this symptom should not last for a long time. A long time is relative, no? Sinasabi ng libro, 1 month, pero I think that's quite arbitrary. Pwede sigurong 6 months, depending on the severity of the trauma. If it's very intense, tsaka isa pang factor hindi na masyadong nadidiscuss is when you are traumatized now, na masyado kang affected, it's almost always because you have been traumatized before. So nati-trigger din yun. So it's not just now. That's what I also observed very much when we dealt with the trauma ng disaster. Yung mama na nawalan siya ng lahat ng kanyang ari-arian, ng kanyang harvest was the next day and it all was gone. But he was so severely traumatized, hindi siya makatayo, nakaganyan lang siya dun sa tent. So it was very clear that he was constricted na, no? Yung paralyzed with immobilized na siya. So when I talked to him, it became very clear. Sabi niya kasi nawala ang aking lahat ng mga tanim, naulila ako. Sabi ko, bakit niya sinabing naulila? So it caught my ear. I mean, I heard it very clearly. It turned out that his parents died suddenly and he was not able to mourn that previous trauma. So, titingnan din natin yun kasi hindi lang natin titingnan yung trauma ngayon. So, yung trauma ngayon ng Yolanda, for example, is totally extreme. No? I mean, any normal person who can be healthy and strong will exhibit trauma symptoms. So, hindi ibig sabihin na. In other words, we can say that trauma is a normal reaction to an abnormal situation. So, hindi ka abnormal kung na-experience mo lahat yun. Because the situation of being traumatized is the one that's really extraordinary, yun, hindi yun normal. Yung magkaroon ka ng Yolanda, hindi naman normal, everyday occurrence yun.
Yes.
Mamatayan ka ng anak, hindi naman everyday occurrence yun. So, it really taxes the coping system of the person, the whole system, psychologically, physically, masyadong na-stress, no, yung system. So it can break down. So therefore, it's very important to understand that people who react to trauma must be understood as not being crazy, yung ganon, no? That there are normal reactions, extreme, because the situation is really so intense and traumatizing. Yun ang
So, a situation like the super typhoon
Yolanda,
can bring about a change in personality in normal, so to speak,
in a normal
individuals.
individual, a situation like Yolanda can really change the behavior. Okay, change the behavior of the person. So, palagay mo, dati hindi naman siya nagsisisigaw, ganon. Or maraming mga nakita tayong mga images sa television, di ba? Parang, bakit nagagawa ng tao yun?
Yes.
Oo. Well, actually, because of the extreme shock or extreme pain or extreme trauma na nga talaga, mag-iibang behavior mo eh. Pwede kang maging kahit na ano na lang dyan, to survive, kukunin mo ng kahit ano na lang dyan, no? Paano nagiging irrational ang behavior ng tao. Kung titignan mo na hindi mo iniisip na may traumang nangyari, titignan mo lang sila, akala mo, hindi sila talagang normal. But actually, if you connect it with a very intense trauma like Yolanda, kahit sino naman, hindi pwede maging kalma. Hindi pwede maging normal yung behavior mo. So, it's important to understand that para magkaroon tayo ng understanding trauma helps the person who's traumatized, but it also helps the people who are helping and even the people who are watching,
Yes.
who are concerned, because parang when they see that, they will not wonder, bakit naging siraulo ng tao
Or
na yun?
violente.
Oo, naging violente yung
Yes.
tao na yun. Parang at least magkakaroon tayo ng konting compassion. With understanding, we have a little bit more compassion towards the people in why they are behaving in a certain way.
And that is what we want to achieve in tonight's episode, compassion and understanding for those who have been traumatized
Yes,
by
yes.
Yolanda, because the images that we see are quite an abnormal behavior.
Exactly. The behavior is really irrational na, no? But that's out of intense desperation na rin eh. When the trauma hits you, you become powerless, you become helpless. So you'll do anything to feel that you are not totally helpless. Kasi trauma renders people powerless. So to recover from trauma, you have to have some way to make the person feel more empowered. Meron siyang nagagawa.
Like what? Like anong pwede niyang gawin? Like in the situation we've seen in the Visayas, in Samar and Leyte, what can they do? Na, almost all of the images you see, yung gaya ng sinabi niyo earlier, natutulala sila. They do things that a normal individual would not do in a, in a normal situation.
Yes, oo. Actually, pag ganun, kailangan na nila ng tulong. Kasi you will just go through these symptoms eh. So, parang how can you help yourself at that point? Maybe not yet. You'll just have to release and act in a way that you feel, no? That to survive. Pero after that, dapat merong tulong na papasok doon. Maybe a kind of therapy, ganyan, trauma, no? So that the person will be able to first understand what's going on. By understanding, hindi mo hindi pala ako naluloko, ganun pa talaga parang trauma. So, hindi pala ako masamang tao, hindi pala ako siraulo. Yun yung importante eh, kasi we might think that, no, of people. But there, of course, there's also a limit to it naman. Okay, there's also some kind of discipline that has to be done. But it's hard to expect the people themselves to do it eh. Dapat may mga tao who will come in and put order, give them some kind of assurance. Yun ang importante para matugunan yung kanilang survival instinct.
So in talking about the discipline at matugunan ang kanilang survival instinct, we'll talk more about that, Dr. Canandang, when MedTalk returns.
Did you know that studies made by Oxford University scientists suggest that playing Tetris, a tile-matching puzzle video game from the 80s, may reduce flashbacks and other psychological symptoms following a traumatic event? Researchers argue that Tetris, or a visual spatial task, could be further developed into a kind of cognitive vaccine against flashback and can also be used as an alternative to other methods, such as counseling and drug treatment.
We're back here on MedTalk, still talking about post-traumatic stress disorder. Dr. Karandang, I had to write it down because, you know, a lot of people, thousands of people in Samar and in Leyte and in the other provinces nearby experience the same thing. But are all of them undergoing or going through this trauma, this shock, or are there others that have a delayed reaction to what has happened?
Yeah. It's possible because of the intensity of this storm talaga, no, that everybody is at least traumatized. But what's important is to know that people react, even people are traumatized, some become aggressive, some become just immobile, some are just start to talk, some do not talk at all. So we have to also see that it leads to different kinds of behaviors. Pero the behaviors are not the normal behaviors that they have in everyday life kasi na-impact na sila ng trauma eh. So it's also important to see that the impact of trauma depends also on, first, the event itself, no? Kung masyado matindi, and also the situation, the person's capacity, the person's situation, the emotional capacity, the way the person copes, how strong the person is. Has he gone through so much before? Mag-importante rin yun na ito ba yung first or masyado na siyang na-trauma ng iba-ibang bagay tapos nang dumating ito, mas matindi. So we have to understand also the different reactions when people are traumatized. They are all traumatized, but they may react in different ways. They might become aggressive, they might become desperate, no? They grab at anything kasi survival na talaga, no?
Yes.
So you'll think, wow, bakit sila ganun mag-behave? But it leads you to become a different person at that point. Eh, no? But of course, that should not be a permanent thing.
So is it, I don't know the proper word, but are they allowed, for the lack of a better word, to behave in such manner for a certain period of time only?
Well, I think, yeah, we have to balance, no? Allowing them to express normally what is so traumatic, and they have to release it, and they have to be not their normal selves in a way, but there is a limit, first of all, to what they can do. May disiplina rin. For example, kung sisirain na isang buong building, kailangan pigilin din sila. Kasi hindi rin yun okay for the common good, but it's also not okay for the person because in the end, magsisisi din siya na nagawa niya yun eh. So if somebody is able to discipline and put some kind of control, it's helpful for him also, even if he might think he might be resisting at that moment, gusto niyang i-release, pero after a while, sabihin niya, buti na lang hindi ko nasira yun. Magsisisi pa, madadagdag pa niya yung guilt dun sa kanyang behavior or feeling, no? So,
Doctor, we have a question from Facebook.
okay.
What other problems may develop after a traumatic experience?
Okay. So, after a traumatic experience, yun na nga, I think I've explained na pag na-trauma ka, you become, tatawag siguro nervyosa or ganon yung parang nagkakaroon.
Konting ulan lang, you get panicky ka agad.
You get a startle response, no? Hindi ka pwede mag-respond normally. Masyadong ang tawag doon, maliit ang pasensya mo kumbaga or nandun ka na sa threshold na pag konting ganun lang, pwede kang pumutok. So that's the effect. So you can be very ultra sensitive to everything. You can be so fearful of everything. Magkakaroon ka ng mga phobia na hindi na ako pupunta roon, hindi ako makikinig dito, hindi na ako lalakad doon sa banda roon. Magkakaroon ka ng constricted life actually because you will be so fearful of doing anything to a point where ang isa pang importante rin kasi doon sa mga nanonood, kung minsan nanonood ka, tapos napako ka na, nood ka ng nood, tapos hindi mo alam, traumatized ka na.
Yes.
So your whole life can be affected.
Even just from watching.
From watching, kaya dapat siguro alam natin as what, nanonood tayo ng TV, di ba, nakaka-traumatize, which is a normal thing. Pero kailangan i-watch out mo rin na you take a break also. I would suggest, take a break. Tingnan mo rin kung masyado ka nang na-traumatize dun sa napapanood mo, be aware and then take a break because it's not also useful for you. I mean, it does not.
Affects your mental health.
Exactly,
as
it
well, no?
affects your mental
You
health.
may be seeing different images or it may be a different report. But
Exactly.
because you are traumatized by what you see, it's the same thing over and over
Correct.
again.
Parang kasi ang tinatawag doon, tawag nilang VT, vicarious traumatization. Kahit hindi ikaw yung victim, nanonood ka, reporter ka, relief goods, bibigay ka ng relief goods, trauma ka rin kasi it's vicarious. Parang trauma is, in a way you can say, loosely, that trauma is contagious. Parang ganon.
So now, Dr. Karandang, that we've discussed trauma, we've understood the kind of behavior
Yeah,
that goes into someone who has been through trauma, been through shock. Let's go to therapy. How
Okay.
does one
Yes,
recover from it?
Yes, okay. That's very good because I was going to say, if there is trauma, there is recovery. Yun yung counterpart. So recovery also has certain stages, no? The beginning, actually kasi recovery from psychological trauma, there are certain things that need to be done. Ang importante dun is, well, one is that the person can tell the story, can release and tell the story to somebody who will not judge him as a bad person, but who will be able to listen and have compassion. That's one. No? The other is, sana kung maka-experience siya ng safety, parang sana malaman, ma-reassure siya na, may ginagawa na, merong hindi na kayo titira dyan, yung ganon. Kasi kahit na ibigyan mo siya ng therapy, kung nakatira pa rin siya doon, mauulit-ulit, hindi masyadong effective yung therapy mo for the recovery. No? Yeah. And then, very important also is to reconnect, meaning magkaroon pa ng support system. The community, you're not alone. It's very important for the person traumatized to know you're not alone. Hindi ka nag-iisa. Merong community that supports you, meron kang kamag-anak, friends, or even people in the community, neighbors, LGUs, whatever, that support you. That's a very, very important part of the healing, na hindi ka nag-iisa.
Who do we seek help from? Psychologists, a psychiatrist?
Both psychologists, psychiatrists can give the therapy to the traumatized for recovery.
Doctor, we have another question from Facebook. I read about psychological briefing for victims of calamities such as Super Typhoon Yolanda. How exactly does it work? Yes, we hear that a lot. Debriefing.
Debriefing. Yeah,
Yes.
it's a common term that's used now when there is a disaster, when there's trauma, you go there and you do a debriefing. Maybe we need to clarify kasi debriefing is just an initial step. What has happened in the past with our history of disasters, ang dami na niyan, we have gone through that. Sometimes people think that they have helped by doing a debriefing lang. So they sit there and then they make the person recount the experience and then that's it. I think that can be dangerous because what happens is you open up the wound and you leave it open. So I would suggest more a trauma counseling process, recovery process. It's not a one-shot deal. It's a process, may stages. So kailangan i-follow up siya. Hindi pwedeng iniwan mo lang siyang ganon. Kasi I heard the survivor say that, bakit magpupunta dito tapos magkakwento kami, mamaya aalis, tapos another group magkakwento. Parang inuulit-ulit lang kami, wala namang pinupuntahan. So after that so-called debriefing, dapat merong follow-up of the process ng recovery because recovery is a process.
We'll talk more about that, Dr. Karandang, when MedTalk returns. Welcome back to MedTalk. Parents tuned in the whole year round to look for ways to help their children cope with various medical concerns such as attention deficit hyperactivity disorder or ADHD.
Hyperactive, inattentive, impulsive. These are just some of the ways to describe someone who might be suffering from attention deficit hyperactivity disorder or ADHD.
they say that you have to be able to observe it at least 7 months or more that it has been there. Because pwedeng maybe the father worked abroad or there's something that happened in the family. It causes the child to act out. But for ADHD, you should have observed it at least more than 7 months.
But while ADHD is considered one of the most common childhood disorders, with an average onset of 7 years old, many do not know that it can continue through adolescence and even into adulthood. Luckily for 23-year-old speech major Dominic Pe, he has a solid support team composed of family members and friends.
Actually, I did feel very different. It's like, okay, so I have ADHD. I guess it's only now that as I'm reflecting, I look back and I see things, oh, this is how maybe people really look at me differently because of this.
Growing up, he was usually fidgety and was eventually enrolled in a school dedicated to those with ADHD. His brother Noel and sister Nicole also showed signs of ADHD, but the early diagnosis and treatment allowed them to understand and deal with ADHD more effectively.
I guess it's knowing that just because there are problems or challenges on the way doesn't mean that I should stop. Knowing that there's someone, that there were people there for me. I guess it was very exaggerating for them, very tiring, but it helped me to get through.
What are the common symptoms of ADHD? What steps should you take if you are diagnosed with ADHD as an adult? Find out the answers tonight on MedTalk.
Joining us tonight is Dr. Mark Recio Cruz, Head of the Child Developmental Unit at the Capital Medical Center. You may join the discussion by calling our hotline at 548-4678. Hi, Doc Mark. Good evening.
Hi, good evening,
Welcome to the
Angel.
show.
Thank you for inviting me.
It's ADHD Awareness Week, and we'd like to understand and get to know more about this condition. So, Doc Mark, what is ADHD?
Yes, ADHD stands for Attention Deficit Hyperactivity Disorder. This is a neurobiological disorder, and all that it means is it originates from the brain, and it's not something we just imagine, you know. And it is diagnosed by looking at certain behaviors or symptoms. And we have this, what we call a Bible in medicine. It's called the DSM, 5th edition. And here it lists 18 symptoms, and you have to have at least 12. And if these symptoms are present in more than one setting, like say at school, at home, at church, etc., and they start to affect the child's functioning, and we're talking about academic, social, or occupational functioning, then we might diagnose ADHD.
You talk about symptoms, doctor.
That's right.
Now let's go to the manifestations of someone who might have ADHD.
So there won't be any probably physical manifestation, but we focus on 3 main symptoms. Hyperactivity, where the person has a lot of extra energy, and then impulsivity, which is the inability to inhibit oneself. So they will blurt out things, and they will touch things to the point things end up being broken. And inattention, lack of focus. Just those 3 symptoms.
Mm-hmm. In the video, it was mentioned, there was a time frame that's mentioned, 7 months. What exactly does that mean?
So the symptoms have to be, in a way, chronically seen for at least 6 months. So that's if 7 months was mentioned. And present in children less than 12. So you see it early on.
The inactivity or the hyperactivity, aren't kids really hyperactive or really, always curious about their surroundings? So how do you distinguish between a very hyperactive child and someone who might have ADHD?
So we would hold off on diagnosing ADHD in, say, preschool children, because as you say, they are normally active and we want them to be that way. But at a certain point, I wait till the age of 6. Usually by the age of 6, a child is able to sit still in class and be able to focus and be productive. And so again, we don't just diagnose based on the symptoms alone. So if the child is in preschool, then we just expect them to be playing and socializing. But when they sort of get into the grade level, say grade 1, there are certain expectations, say academic expectations, and that have to be fulfilled, that if they are not fulfilling it, then we might consider ADHD.
Doctor, we'll go back to that. I think we have a caller on the line. Hi. Okay, later we'll go back to that, doctor. So let's now talk about you mentioned a child who might have ADHD because they show signs and symptoms when they're going to school already. So what are the types? I understand there are 3 types of ADHD.
That's right. There is the hyperactive impulsive type. The second one is the inattentive type, and those are usually missed early on because they're just quiet and they're not really hyperactive, but they might be daydreaming in class. And the most common is actually the combined type. They are both hyperactive impulsive and also inattentive.
So briefly, doctor, any manifestation of each of the types?
Yes. So for hyperactivity and impulsivity, you would see a child who often runs and climbs instead of walking to their place of
But
destination.
that's normal, diba, Doc?
That can be normal, that's right. And remember, we talk about certain ages and functioning as well. They are very restless. They can be fidgety. So if they're standing or sitting in place, they're moving.
Like Mark, he was fidgety. That's why his mom caught
Dominic,
it right away. I'm sorry,
That's
Dominic,
right.
yes.
That's right, Dominic. So for boys, it's more common in boys, and you often catch them early because they are physically hyperactive. But they can also be verbally hyperactive. They talk excessively. They might blurt out answers. In Tagalog, they might be described as parang nakaupo sa kalan, so they can't sit still. Again, restless. And inattentive symptoms, they would forget things at school. So the parents are always having to buy school supplies. They are very disorganized. Maybe they're daydreaming, drawing during class time. And then, so we consider those symptoms.
We'll talk more about that, doctor. But now we really have a caller on the line, Mary Rose Ballesteros. Hi, Mary Rose. Good evening.
Hi, good evening.
Hi, your
Angel.
question, please,
Doc,
for
good
Doc
evening.
Mark.
I'm sorry?
Your question, please go ahead with your question.
Yes, my son was diagnosed a couple of years ago. He's now 9 years old and in 3rd grade. My problem is he's not typically inside the classroom very rambunctious, but when he takes his test, he gets really low scores. And I study with him, every night. But the problem is when he takes his test, they come out really badly. So is there any way to kind of improve that skill of his?
Thank you, Mary Rose. Doc Mark, as a
Yes.
developmental pediatrician.
Thank you, Mary Rose, for that question. Children with ADHD, that often is a challenge doing homework with them, and hoping to make it a positive experience. They often take more time. And in fact, the parents will see that even though they're one-on-one, that they will see their child making excuses to get out of doing it. They need to go to the bathroom, they're hungry, etc. And so we commend Mary Rose for being the tutor of her child with ADHD. In fact, if the issue is not usually intellectual, because children with ADHD are often smart, they have good IQs, but the problem is focus. So, you put the student now, her son, in class with other students, and there's one teacher, and then because the child is easily distracted, they're not able to finish on time. Sometimes they do finish, but they're rushing their work just to get done. And so they're not able to give their best effort. And there are actually medications that could be considered, Mary Rose, We won't force it upon you, but there are medications that can help your child to focus while he is in class and just be able to give his best effort.
So, in giving the best effort, you commended Mary Rose for understanding and being very patient
Yes.
with her son.
And indeed, they do need a lot of patience and understanding and extra love, as their behaviors can be very challenging. for parents who have children with ADHD.
You mentioned behaviors can be very challenging with parents
That's right.
of children who have been diagnosed with ADHD. How is it diagnosed? Are there tests that determine if there is ADHD in a child?
ADHD is mainly a clinical diagnosis, so there are really no tests that we can recommend routinely. Now, first we do a good history, we interview the parents, and any information is helpful, so report cards, love letters from the teachers and guidance counselors, and from the parents themselves. And then we have to make sure that we're not missing any other condition that might look like ADHD, but is actually not ADHD. So simply say sensory issues, if the child might need eyeglasses and can't see the blackboard and is looking inattentive, if they have a hearing problem, children with diabetes and hypothyroid issues, children with seizures, they may present with symptoms of ADHD, but actually they do not have ADHD, and sometimes even just a lack of sleep. If they get a good sleep, they stop being hyperactive.
Or they can be hyperactive sometimes because of too much maybe candy, or
In some cases, yes. So that the parents are supposed to avoid giving them certain food drinks or drinks that might cause hyperactivity in their children.
how about watching television?
You see, some parents would mention that they think that their kids don't have ADHD because they can watch TV all day. So, but see, children with ADHD can focus if they want what they're looking at and studying, and if they're reading a book that they enjoy, they can do that in one sitting actually. A video game, same thing. So they're able to hyper focus as well. But usually the issue is focusing on schoolwork, and that is the problem. So,
Doc,
yes.
I'm sorry to cut you there, but we have another caller on the line. We have Eileen Crisostomo. Hi Eileen, good evening.
Yes, hello po. Good evening po.
Good evening.
My
Your
question is, my child has been diagnosed with ADHD and is hyperactive most of the time. When this happens, I just let him watch TV to keep him in one place. Is this advisable?
Thanks, Eileen.
Thank you, Eileen, for your question. We do not advise that, Eileen, because in TV it's very stimulating. There's the visual stimulation, there is sound, auditory stimulation, and if it's even computers, gadgets, hands-on stimulation. But in class, the child is having to listen to a teacher who is lecturing in the front of the class, and that will become actually boring for the child, because in TV it's a split second, you see 3 frames, and it really gets their attention. So that does not help. What helps for them is providing them with a lot of structure, give them a schedule, and actually lessen the TV time.
So lessening TV time would also lessen what does it lessen actually?
Well, with TV, it is quite unlike real life, where again the stimulation is not so, say, in the classroom setting. So instead of, say, just TV, maybe providing the child, if you do turn off the TV, Eileen, provide your child with activities in replacing the TV, like, say, if you do some crafts maybe, and stimulating his creativity, because children with ADHD are often very creative as well, They can make things out of nothing, out of garbage actually. They can put things together. So it's not just turning off the TV, but providing other activities to stimulate the child.
Doc Mark will talk more about ADHD, its treatments, and how to manage a child who has ADHD when MedTalk returns.
While ADHD does not have a known cause, studies suggest that there might be a probable connection between alcohol intake and smoking during pregnancy and ADHD in children. Children who are also exposed to school walls that use paint with high levels of lead are also at risk of developing ADHD.
We're back here on MedTalk, still talking about ADHD. Doc Mark, let's now go to the causes. What are the possible causes of ADHD?
Well, we do know that ADHD is a genetic condition, so namamana siya.
Like in the case of Dominic,
Like
his
in Dominic's
brother and his
case.
sister.
That's right, oo. And I think even a parent.
Oh,
But
okay.
I know the parents are good friends too, no, and wonderful advocates for people with ADHD. It's not to blame anyone, but there is a very heavy genetic predisposition, meaning that if you diagnose someone with ADHD, if you look at their family tree, there will be a good number of direct family members who would have the condition, more commonly seen in boys, but you can have it in girls as well. There's also prematurity, children who are born early, and children who were in their mother's wombs and were exposed to alcohol, cigarette smoke, nicotine basically, drugs maybe when the mom was pregnant. Any injury to the brain can cause ADHD as well. Children who were neglected, abandoned, this might aggravate the condition of someone who has ADHD.
We've mentioned the causes, no, doctor. How about the cure for those who have been diagnosed with ADHD?
There is really no cure for ADHD, but it is a very manageable condition. So that's the good news. And mainly a lot of, again, love and understanding, as Dominic experienced from his family. We do behavior modification. So there are certain negative behaviors that a child is exhibiting. So what can we do? What can we talk to the parents about how to handle those misbehaviors? And we want to focus on more of the positive reinforcement, offering rewards, a lot of praise, and the positive good words of love and encouragement. And there's also, again, the medicine that we can also use for children with ADHD. It's not a cure, but it helps to minimize the symptoms of ADHD.
Doctor, we have a question from Twitter. My friend told me that in the States, they have ADHD coaching for adults. Is this also available in the Philippines? What are my options?
Yes, that's right. It's ADHD coaching or mentoring, kind of like having a life coach. And you can, if you have a kid with ADHD, you can in fact find a faculty member, maybe in school, a teacher, who would be able to just check up on your child and say even 10, 15 minutes a day. And that gives added motivation for the child to do well, because if the coach says, I have to do my project because my coach will ask me about it today, if what I've done. And for this adult who called in, they can call the ADHD Society of the Philippines to ask for referrals. We do have professionals connected with the society who do ADHD coaching.
Okay, we'll flash that number a little
Yes,
later on.
you.
Doctor, now we have a caller, another caller on the line, Mark Tuazon. Hi, Mark. Good evening. Mark?
Hello.
Hiya. Hi, Mark. Good evening. Your question, please, for Doc Mark.
Hi, good evening, Doc. I just have a question. Do we have alternative medication for ADHD? I'm actually worried about the side effects that it may cause my brother.
Thanks, Mark.
Yes, thank you, Tokayo, for your question. There are some small studies looking at DHA, or it stands for docosahexaenoic acid. Yung other names are fish oils or omega-3, which you can get in fish in your diet, but you can also get as supplements. The studies are small. We're talking about studies looking at, say, 30 subjects that showed that there was improvement in memory and focus. So you might be interested in looking that up. But the medicines I'm referring to are actually prescription medicines that have very good scientific evidence that they help. And, we can talk about side effects too. It's not like we just, prescribe a drug. There are side effects, but those can also be managed.
Okay. Doctor, we have a question, this time from Twitter. Will my child outgrow ADHD?
He might or she might outgrow ADHD. The statistics are, that 70% of children diagnosed with ADHD continue to have the symptoms to adulthood. So there's that 30% that will just might outgrow the symptoms.
What is the goal, doctor, in treating the condition?
Yes, it's really early intervention. Children with ADHD, if they're always getting this negative feedback, right, that they're not paying attention, sit still, stop talking to your seatmate. I mean, these are all negative, feedback for the child. They can develop actually depression. They can develop an anxiety disorder. They're afraid to go to school because they know that they're just going to be reprimanded. And so that this becomes a negative thing. So if we can manage it early, then they start to develop a positive self-esteem, the way they look at themselves, they become confident, they start believing in comments that they might not be smart enough, but when they are managed, suddenly they're excelling academically, and then they prefer that. Rather than getting the negative feedback, they now would prefer getting all of the positive comments.
And you mentioned getting the positive comments. Earlier, you also mentioned that they're very artistic.
They can be very artistic, and it could be very athletic. They are leaders actually, and they have this extra energy. As I mentioned, they are very decisive. So rather than leading their classmates to do something negative, they can actually lead their classmates to doing something positive.
It's very nice. Doctor, we have a caller on the line, Jen Bermudez. Good evening, Jen.
Hi, good evening.
Hi, your question please for Doc Mark.
Yes, we had our son tested recently, and the psychologist said that he has very superior intelligence, but he has projective ADHD. What does it mean? Because I haven't seen the actual report yet, but I'm just curious what it means, projective ADHD.
Thank
Sorry,
you.
I missed the term.
What was it again, Pro?
What's projective ADHD?
Projective ADHD.
Projective ADHD. So, John, so I'm not familiar with that term, but if perhaps if the psychologist is not actually diagnosing your child to have ADHD, but possible ADHD maybe, possible ADHD. So then you would have to seek professional help from someone who could make a diagnosis if your child
Yes.
is indeed.
Okay.
Okay, thank you. Thank you, Jen. Okay, doctor, another question from Facebook. How can I help my child who has ADHD succeed in school? We were talking about this earlier.
Yes, that's a
also.
wonderful question, because that is indeed our goal. Children with ADHD are capable of being enrolled in regular traditional schools even. It might be more challenging, but they're capable of doing that. And often they come out as underachieving, because they are smart, but if you're not taking down notes, they memorize. They don't write down their homework. They don't finish their tests because of distractibility. Then in a way, they have lower grades, but they're capable of really excelling and being the top student. So it has to really be with managing the symptoms. And again, there are ways of managing the condition that can be discussed. And so please seek help from professionals who could help you out.
Okay, thanks, Doc Mark. Now we have another question from Facebook. My daughter has a hard time sleeping after drinking meds for ADHD. How can I help her get a good night's sleep?
So in fact, that is one of the side effects of the medicines, is insomnia. So rather than treat the lack of sleep, we would do prevention, give the medicine earlier in the day.
Okay.
So that by the time the child's ready to go to bed, the medicine won't be working anymore. Because with the medicines, they actually stimulate the brain to start working and focusing.
I thought it was the opposite. It's supposed
Like
to
a
calm them
sedative,
down.
right? Yes. So for some reason, it works on the chemicals in the brain to actually make the brain start working, but it makes you calm. That is right. It makes you calm, but your mind is actually working and working hard. So then even if you wanted to sleep, your mind will want to work.
So earlier.
So give it earlier.
During the
Consult
day.
your doctor about giving that medicine earlier in the day.
Okay. Doctor, final words, how do you help your child who has ADHD?
Yes. Well, children with ADHD can achieve academic, occupational success with proper intervention and support. So think of the likes of Michael Phelps, the most bemedaled swimming athlete in the Olympics, Will Smith, the actor, many famous people with ADHD, John F. Kennedy. So they can indeed succeed But the earlier the intervention happens, the better for the child.
See you again next Tuesday, 7 p.m. on our initial offering for a brand new year, 2014. This is MedTalk, your scheduled on-air consultation here on the Solar News Channel. This is Angel Jacob. Happy New Year, everyone.